IVF is a very long and involved process. Here is a brief breakdown on the steps of the procedure. Testing. Basic screening tests are performed on both partners at all IVF clinics. These tests can reveal how a woman's ovaries will react to the drugs, making sufficient follicles and eggs. The number of follicles that develop when stimulating the woman correlates with the number of eggs doctors can get at the egg retrieval procedure. Consent. Both parties must sign consent forms regarding the procedure and documents in case of possible future circumstances. These documents can help decide the future of a frozen embryo in case of divorce or death. The participants must sign before any further procedure can begin. Injections. The woman is stimulated with injected medications to develop multiple follicles in the ovaries. Each follicle contains a microscopic egg. These injections continue to stimulate follicle, egg growth, and development for about 8 to 10 weeks. Egg retrieval. When a sufficient number of the woman's follicles are mature, a transvaginal ultrasound-guided egg retrieval procedure is performed to remove the eggs from the follicles. Finally, results. The eggs are then fertilized in the laboratory with the patient's partner's sperm. Embryos are cultured in the IVF laboratory for 2 to 6 days. After the embryo transferal procedure is completed, embryos transferred into the woman's uterus, they will hopefully develop to result in a birth. If a sufficient number of embryos are left over after the transferal procedure, they are often preserved by being frozen, of course at the patient's consent.